Do you hear people kind of indiscriminately talk about the importance of core exercises? And I do my core work, and hearing different things about the importance of the core, whether it be for back pain or for shoulder issues or whatever it is going on, but you don't exactly know what that means. A lot of people use those phrases but don't really describe what they are. If that is something that you have some questions about or are interested in, then this video series is for you. My name is Biagio Mazza. I'm a physical therapist at Elite Physical Therapy, and this month's series we're going to talk about core exercises, the importance of core exercises, what they actually do, what is the core, and why it's important for your spine, your body, and what it can mean for your body if you have a weak core. Okay, so today we're going to talk about what kind of happens when you have problems or weakness in different areas of the core. Just for review from what we've talked about before is that we're going to isolate the core just down to the low back just for purposes of this video. And the 1 through 5 here are the stack of vertebra or the bones that are in the low back. The discs are the shock absorbers that go between the vertebra. Down at the bottom, this triangle here is the sacrum or the tailbone. Everything is stacked like blocks. The part of the core that controls the front, so this is a person facing straight on this way. The part of the core that controls the front of the body is the abdominals. The back of the body, kind of comprising a bunch of different type of back muscles, is the thoracolumbar fascia, which is not that important, but it gives us something to call the back end of the core besides just back muscles. The bottom of the core is controlled by the pelvic floor, and the top of the core is controlled by the diaphragm. So all combined, these areas create a kind of a can around the spine to create some abdominal pressure and control so that when you move around, your spine doesn't just shift around in a bunch of different areas and create problems. But let's give our diagram here a problem. Let's give them a weakness, and let's say that they have a problem with their abdominal muscles. In this circumstance, it doesn't always happen this way, but in this circumstance what can happen is if the abdominals are weak, they can elongate. If they get long, the body tends to shift into more of a lordotic or a rounded position to where your spine pokes out this way. So we get a bigger curve in this direction. Some curve is normal for sure, but if you get an excessive curve, that can cause abnormal loading into the spine. When you load into the spine abnormally, these vertebrae that should place nice pressure on each other through that natural curve create a different type of load. So that load can create more pressure on the backside of the vertebra and the discs. So what can happen there is that these discs can get little cracks in them. They can get what are called annular fissures or tears in that disc area. These discs can have, because of the pressure there, can either leak fluid out, they can actually bulge or create compression onto the nerves as they come down. So that's one example of something that can happen if you have weak abdominals. Let's say that your abdominals are fine, but you have weak back muscles. Well, the opposite can happen. So if we create weakness in the back, many times people will lose their extensibility or control and fall back in the opposite direction. So this curve that's excessive here will go the other direction. Okay, so your pelvis will kind of fall back the other way, and it can create and lead into problems with what's called stenosis. So stenosis is a general term that just means closure. So closure around the spinal column. The nerves of the spine flow down the back side of the vertebra if we're facing this way, and they have a certain amount of space that allows for the protection of the spine, but it also gives it some breathing room. If that breathing room isn't there and we get closure around where the nerves are exiting, you can get pain that shoots down the legs, you can have problems with weakness, you can have all sorts of issues that occur. So these are a couple generalizations, but they're broad terms that show what can specifically happen when you have some weakness or dysfunction of your core musculature, specifically with the back and the abdominal muscles. I hope you enjoyed today's video and you learned a little bit more about the core and maybe some specifics that you hadn't known before. If you are interested in learning more about your specific body and about what's going on with how your core is functioning, and you want to come in and do a free consult with me at Elite, just give us a call, 816-941-2550, or email me, biagio@eliteptkc.com.